After months in a virtual classroom, many children are starting to return to in-person ones now. And while many parents may be looking forward to this milestone during the COVID-19 pandemic, they may also have questions about safety, including protecting their families from exposure to not only this virus, but any other illness that they now may be exposed to. That's where the importance of back-to-school immunizations come into play. In helping us communicate that, we asked two Topline MD Alliance-affiliated pediatricians to provide some insight. Thank you both so much for joining us and giving us your knowledge on these important topics. So first off, before we get into those required vaccines, why are vaccines so important, especially when kids are heading back to the classrooms?
We as pediatricians care so much about our patients. They're almost like our children. And we just do everything we can in our power to keep children safe. And having done this for, I'm not going to say how many years, we have seen some of the disasters and consequences of certain illnesses that we can now prevent. And what I always say to new parents is, you'll see the first time your baby gets a cold or sneezes or coughs, like, oh my gosh, what could I have done differently to prevent this? There's not only so much you can do in terms of preventing certain viruses, but if there was an infection that could cause major problems with your child that you could have prevented, you just want to do everything you can to do so.
And many people have said that one of the greatest inventions of the 20th century were vaccines. Countless illnesses have been prevented. Millions of lives have been saved directly because of vaccines. Things that people saw 50 years ago, measles, mumps, rubella, diphtheria, pertussis, varicella, and more, we don't see anymore. And that's directly responsible because of vaccines. One illness in particular, smallpox, was eradicated due to vaccines. Not natural illness or natural protection, but with the help of the vaccine.
So an essential part of any parent's back-to-school checklist should also include making sure their child's vaccinations are up to date. Which vaccines are required for children to go back to school?
Well, I think there's two specific grades that vaccines are necessary. Kindergarten is one of those age groups, and they get the DTaP, the MMR, and the varicella, along with the polio vaccine. And then in 7th grade, going into 7th grade, the mandatory one is the tetanus vaccine. A lot of other pediatricians also follow the CDC guidelines and give the Gardasil vaccine, which is for HPV, and also Menactra, which is for meningitis.
And so those are all boosters, by the way. So we start the series of vaccines as early as the hospital for the hepatitis B vaccine. And then we see children younger at 2, 4, 6, 9, and 12 months to complete the first year's worth of vaccines. And then we continue to do boosters the second year of life. And then when they go into school at 5 and 11 to 12, we make sure that they are up to date on everything and give them hopefully their final boosters at that time.
And how do parents know which vaccines they've gotten and which ones they haven't gotten?
We have a system in the state of Florida called Florida Shots, where each vaccine should be entered into a central database. So when someone does go from county to county, or if they move to different parts of the state, they can access Florida Shots anywhere in the state so that we can see who's had the vaccines and people won't have to be mistaken to have gotten any extras. So their pediatrician's office is the best resource for that because we have access to the Florida Shot system and we can get them the paperwork they need to show them that the children are up to date.
So did COVID-19 change any of these required vaccinations for back to school?
COVID-19 did not change any of those requirements. Children are still need to get those vaccines to go into kindergarten and 7th grade. And parents that got their children the COVID-19 vaccine, they don't have to worry about waiting a certain period of time before getting their vaccines. The CDC has said they can get their COVID-19 vaccine at the same time as other vaccines as well.
Where can parents get their children vaccinated for these required vaccinations or any other?
I think it's important for them to take their children to their medical home to see their pediatrician. Their pediatrician will have all the vaccines necessary for them to be able to go to school, and also for all the vaccines that are not necessary for school, but also on the CDC vaccine chart.
And those who don't have a medical home can go to the health department, So for example, Palm Beach County has a health department, obviously as do other counties, that can give vaccines to those whose insurance may not cover it or who don't have a medical home. But again, I agree with you completely. You want to make sure that you can find a medical home, because there's nothing better than having a place you can go that I love. The best part of my job is I get to know the families. I get to know sometimes the grandparents, the aunts, the uncles, the cousins. It's awesome. So it's really nice to be able to do that. But for those who aren't able to do so, then they can get them to the health department.
And vaccines are usually covered by your insurance plans. But for those children that do not have insurance, then there's the Vaccine for Children program, which is a federally funded program that there's not an excuse for a child because of income not to get their required vaccines.
There have always been parents who have had concerns about vaccination and vaccinating their child. I wanted to get some of the most common questions or worries answered from the two of you. So what's the biggest concern that you guys have from parents usually when it comes to vaccines?
I mean, I think one of the biggest ones are whether there is, can my child get autism from these vaccines? There have been numerous studies that have debunked this myth. Autism, we know that there's a genetic component to it, there's an environmental component, but one thing for sure we can say is that vaccines do not cause autism.
What's so frustrating for us about that is it was reported by someone who had a financial incentive to find children that had medical problems from the measles vaccine. And he was in cahoots with an attorney who was making money when the parents were suing the immunization companies, and this was in England. And so it did a tremendous disservice, because once that happened, people stopped giving their children the measles vaccine, and there were measles outbreaks, and children died of measles after that. So I always encourage people, you can almost read anything you want online, whether it's true or not. You kind of believe anything. So really just go to the resources, go to the right sources to make sure that these are the people that have done the research and studied the research before recommendations are made.
So this myth about vaccines causing autism, a lot of it has been about getting too many vaccines at one time.
Right, so that myth has led to many alternate vaccine schedules that are not based on science. Your newborn, your young child sees every day thousands of immunological components through viruses, bacteria, germs. These vaccines that we have nowadays are much more efficient, much more pure in terms of the amount of components in them. A baby can receive all those vaccines all at one time and still have less immunological parts than they'd see every single day.
And just think of the babies coming through the birth canal. That's not a very clean environment, okay? So these vaccines are much more sterile than that, and as Tony was saying, they're purified. So they're much better than they were before, and much better than the infections themselves. So fortunately, the immune systems are pretty tough in kids. What I've heard many of the infectious disease specialists who, again, this is their area of expertise, say, is that the vaccines are almost too good. We don't have a concept, because we're living in 2021, of what these infections were and how they've hurt children before. And so we don't always have the perspective to know how bad it could have been. And we're very lucky that these children and our children now are able to get these vaccines that prevent these horrible infections.
Just like Amy said, vaccines are a victim of their success. Young parents nowadays they question, why do we need all these vaccines? We don't see these illnesses anymore. But just as we had mentioned earlier with the measles outbreaks, when we drop our guard and we stop vaccinating, then these illnesses come back.
And children die. They not only get very sick, but they die. And again, you want to do everything you can to protect your child.
We have more resources on our website, toplinemd.com, for parents to learn more about all of these vaccines and how to prepare your kids for the upcoming school year.